Welcome to Meaningful Conversations with Dr. L.
So we are back. And for those of you who are new to our podcast, Meaningful Conversations with Dr. L, even though it's been almost 2 years, like I said in March, since we went into hiatus, our mission is still the same. And really it is to educate, inspire, and challenge us to not just go with the headlines and trending topics of the hour, but to really think deeper and more critically about social, political, spiritual, and health issues that are impacting all of our lives, our families, our communities, our state, and our nation. And so it is a thrill to finally be able to do this again. Some topics, I will admit, will inspire you. Some will make you laugh. Others will make you spitfire mad. And some will hopefully leave you, most of them will leave you better than when you entered into the conversation with us. A lot, and that is an understatement, a lot has happened since we last engaged in our last meaningful conversation. So we will not be short of topics, I am sure, or opinions to pick through and to think through. I wanted to kick off this segment, the third week of Black History Month, with an important conversation about our health. Specifically, tonight's segment is titled, "What is Making Black America or Black Americans Sick?" And I could not think of a better person to have this conversation with than our special guest tonight. And that is none other than Dr., that's an MD, y'all, Dr. Alan Mask. Dr. Mask is a native of Hamlet, North Carolina. Some refer to that as a railroad town. It is in rural North Carolina for all of our followers and supporters around the world, because when we initially launched Meaningful Conversations, there were a few people watching from Ghana on Facebook, so that was good to know. So that's in rural North Carolina. He attended racially segregated schools until the 11th grade. Dr. Mask is an internist as well as an anesthesiologist. He completed 2 residencies, the first at Massachusetts General Hospital and Harvard Medical School, and the second in anesthesiology at the University of North Carolina. So when I say the man is brilliant and smart, y'all, I mean, that's an understatement. Where he attended both college and medical school at UNC Go Tar Heels. He practiced anesthesiology with Burlington Anesthesia Associates in Alamance County for several years. Dr. Mask is also the medical director and founder of the Raleigh Urgent Care Center, which is one of the oldest urgent care centers in North Carolina. And in addition to his primary practice, he is also a physician, and including a physician to the artists for Live Nation Entertainment. He also has a deep interest in community affairs, which is how we connected. I've always watched and followed him and his wonderful family, particularly the community affairs, particularly involving health, education, and the arts. And he approaches these from a social justice framing, a civil rights and human rights frame. So I really appreciate that. He serves on the John Rex Hospital Endowment Board, the North Carolina Theater Board, and Elon University Health Advisory Board, and the Raleigh Board of Wells Fargo Bank. He has previously served at UNC Hospital's Lineberger Cancer Hospital Board, the Carey Academy Trust Board, a whole list of others. We know him and have watched him in North Carolina as our television doctor. So long before there were other doctors, and I'm not going to call any names, on television, we had here in North Carolina through WRAL, Dr. Mask, who was the go-to physician. And so we loved, and trusted the information and the guidance that he provided. Dr. Mask is a father of six. The oldest attended the UNC School of Medicine, and the youngest now attends UNC School of Dentistry. He lives with his also Dr. wife, Deidre, who is a gynecologist, and their dog Zoe in Chapel Hill. And it goes on and on. One of his daughters, Sydney, is married to a Campbell graduate, and another daughter, Alex, whom I love. I love all of them. Also is Campbell alum. And Sydney, may I mention, is a member of the North Carolina General Assembly. She is Sydney Batch, and a fierce advocate for children and families in our state. So, Dr. Mask, welcome. Welcome to Meaningful Conversations. It's a pleasure to have you here.
Pleasure to be. I'm looking forward to our conversation. I hope you can hear me okay.
Yes, we can. And I apologize for that little hiccup at the beginning. I'm not used to running the board, as they say, and we're doing it from home. We used to do it through a radio station, and at the relaunch, we are now just doing it here in Dr. Laws's office. So so thank you. Let's just jump right in. Our topic tonight is what is making Black Americans sick. African Americans or Black have the second lowest life expectancy at birth of all racial and ethnic groups in the United States, after American Indians and Alaska Natives. According to the CDC and other credible sources, the NIH, National Institutes of Health, in 2022, at birth for Black African Americans, the life expectancy was 72.8 years, 73 years, 76.5 years for females, and 69.1 years for males, compared to 84.5 years for Asian Americans, 80 years for Hispanic and Latinos, 77 for whites, and 67.9 for American Indians and Native Alaskans. We know that some of the leading causes of death for African Americans is heart disease, some forms of cancer, unintentional injuries, stroke. We know that we still live in the stroke belt in the South, and COVID. The COVID-19 pandemic was particularly devastating for Black Americans. We had the highest death rates for the majority of the pandemic, starting out the gate. And we know that that was because many of us had multiple chronic health conditions, and on top of the harm that COVID was doing, or the risk that COVID presented, it impacted us already sick. So knowing these stats, and we'll talk a little bit later about Black maternal mortality and infant mortality, but knowing these stats in terms of the general population, what's making us sick?
I can tell you, Michelle, this is such a wonderful conversation to have. And what I want to talk about tonight is just the chronic stress that African Americans have gone through the years since our arrival here, the systemic racism that we've had to go through, the enormous distrust of the medical system. We know that African Americans have had substandard health care for a long, long time. If we even go back to the times of slavery, our health care at that time was minimal. It was sort of a no man, no woman's land right after the end of the Civil War in terms of where we were going, how we were going, what sort of healthcare we could get. But it's this chronic stress that is problematic, as well as the systemic racism that makes everything worse. We know that know that stress can increase hypertension. It can make that worse. We know that by stimulating cortisol levels, stress can increase our blood sugar, increasing our incidence of prediabetes as well as diabetes. We know that stress will retard the healing process. So if we're recovering from surgery or from a wound, stress makes that worse as well. We know when it comes to cancers or arthritis that the stress is increasing inflammation as well. So in that scenario, we know that stress overall is not mainly the primary reason why one may have hypertension, but it certainly is making it a lot worse. And so this chaos that we're going through right now with 47 and all the uncertainties in so many different areas, we just know that we need to focus on really taking care of ourselves. We've got issues of food insecurity where our citizens are not getting the nutrition they need. We have the problem of housing instability in terms of people trying to find a safe and warm place to reside during this cold weather that we're experiencing right now. We also know that we lack adequate exercise space, and we want to be able to go out and to enjoy ourselves and stretch and exercise and do the things that we need to do to be healthy. And so I think this conglomeration of things is really what's stressing us out, particularly as Black Americans. Now, there's a group called the Commonwealth Fund, which is out of Massachusetts, that asked physicians in general if they thought that there was racism in medicine. And 40% of those doctors, these are white doctors and Black doctors, say, yes, we see a racial discrimination. They're admitting that. We also know that doctors have said that about 50% of their patients have actually complained to them that racism in medicine is contributing to their lack of well-being as well. So we know that's a real problem that we need to address. There's a huge access problem to healthcare as well in terms of having community health centers and in terms of patients, not having insurance and having the easy access to healthcare. We know that the United States is the only country in the developed world that doesn't have universal health care for all of their citizens. You can go to South Korea, you can go to Finland, you can go to Sweden, Canada, the UK. All these developed countries all have universal health care, but in fact, we don't. Now, we talk a lot about the United States having an advanced healthcare system, and if you need to have a hip replacement, if you need to have coronary artery bypass surgery, this is a good place to go. But you've got to work through the racism part of it and be an advocate for yourself. And you got to have health insurance, and so many of us just don't have that. In so many categories, I was over at NC State not too long ago. I gave a lecture to some French students there who were visiting, and we compared the French healthcare system to the American healthcare system. And so many things in France were being done better than we do here in terms of access to care, in terms of costs of care, in terms of access to specialists and so forth. And in so many categories, America not only falls behind France, but so many other countries as well. So we'll talk a little later about this, but we've all got to be self-starters. We've got to take good care of ourselves and figure out what we can do to improve the health of ourselves as well as our families.
Yes, and we're gonna get into some of the action steps that we can all take to improve our health outcomes as African Americans in particular. I wanna unpack a few things. So we know, let's talk about access to health care, to quality health care. We know that even with health insurance, there was a study that was done that looked at Medicaid recipients, for example, who's even comparing persons with that type of insurance. And that is an insurance. That's a payer. Medicaid is a payer. And I remind people of that. They think it's a program that provides or delivers health care or delivers services. It doesn't. It pays for services that have been approved. And each state submits to CMS, the Center for Medicaid and Medicare Services, their state plan on what services they will be paying for and covering. And so it is a payer, just like Healthy Blue, United Health, WellCare, and so forth. There was a study done, Dr. Mask, that compared the health outcomes of persons with Medicaid to persons with private health insurance, like a Blue Cross or a United. And the health outcomes for persons with on Medicaid were worse than those with private health. So on the one hand, people say, well, just give us give people health insurance and that solves the problem. Why does that not solve the problem? Why do we still see disproportionate outcomes for poor people who have health insurance compared to those who don't, who are of higher socioeconomic status and who don't have like a public payer like a Medicaid, but private insurance?
In the healthcare space, I remind everybody that healthcare and our experiences in medicine are just a microcosm of what exists in the world. So when we think of discrimination when it comes to housing, we think of discrimination when it comes to jobs, to transportation, and so forth. Within the medical area in and of itself, there's still, whether you call it implicit bias or not, there's still racism there. And I'll take it even further. It's been shown that African Americans who have traditional healthcare insurance, let's say you have a white family that has Blue Cross Blue Shield and an African American family that has Blue Cross Blue Shield, they're still less likely to get the services that insurance would provide you. So we know, for example, that when it comes to implantable defibrillators, if you have some heart failure, if you have a reduction in what's called your ejection fraction, it's the amount of blood that's pushed forward every time the heart pumps, that there are criteria where one needs to get an implantable defibrillator. And studies have shown that even with traditional health insurance, African American Blue Cross Blue Shield versus a Caucasian Blue Cross Blue Shield, we're less likely to get those services. We know, for example, that these same patients are less likely to get vaccinations, less likely to get colonoscopies, that when they're in the emergency room waiting to be seen, if they have to be admitted, then they're likely to take much longer to get them up to the floor than it is for Caucasian patients. We know that we're 10% less likely to be admitted to the hospital with a serious condition. We know that we're more likely, if we are going to die in the emergency room or to die in the hospital than Caucasian. I think the figure I remember is 1.26 times more likely to do that. So it has to do, I think, with Medicaid versus private insurance, what makes it even worse. Even if you get that good job and you got the traditional health care, you're still likely to get less care.
And another factor too, another thing to consider is I remember the studies that came out about Black women less likely to be believed and Black people in terms of the level and degree of pain that they have. So this perception that for some reason we can tolerate more pain, and that's rooted in racism. That's rooted in structural inequities that stem from slavery. So let's talk a little bit about historical medical traumas that have impacted not just the delivery of healthcare, but also impacted our experience. Everybody talks about Tuskegee, but really, why should everybody be concerned about this legacy of racism? Why should everybody be concerned about it?
Well, I think there are two pieces of that. Speaking of pain medications, we know that when African Americans will go to the emergency room with what we call long bone fractures, they're really very painful. We're less likely to get opioid analgesics, which you need at that time. And we're also less likely to get those pain medications written for us when we're discharged as well. We also know that when we go into the emergency room with some sort of a psychiatric problem, that we don't get adequate care with that as well. For example, we're more likely to be restrained than Caucasian patients. So if we came in
Or arrested.
exactly. So, I mean, and there's so many facets of this that are problematic. And I think one of the solutions that we can talk about this later is that we have to educate ourselves, we have to be self-aware, and we have to be strong advocates for ourselves. It's so important, I think, if you got a loved one going to the hospital, that you be there with them, not to sort of let the medical community take care of them, but you're there being an advocate so that you can do that. And there is this distrust of the medical system. And I think it goes back years and years, the Tuskegee experiments and situations where we know that patients were infected with syphilis and then purposely not treated in order to understand the pathophysiology of syphilis. We know there have been situations where Black women have been experimented with as well, gotten unnecessary hysterectomies. We know that our kids who have been candidates for kidney transplants, for example, have been less likely to get them. We know that adults who are suffering with end-stage renal disease are less likely to be put on wait lists and less likely to get transplants. There's typically a longer period of time before they actually go on dialysis if their disease is really progressing. And so we can go way back. I mean, I think that was the reason that,
But
I'm sorry, go ahead.
no, go ahead and finish that thought, and then I'll.
If you look back to how our ancestors tried to take that over themselves, the Leonard School of Medicine was established in 1882 on the campus of Shaw University, eventually closed, I think, about in the late 1900s. Then we had in 1896, the St. Agnes Hospital, which existed from 1896 until about 1961 with the opening of Wake Medical Center. So I think we've been trying as a people to address these needs really within our own communities. But I think it's important for everyone to realize that the racism that we experience in so many other areas exists in medicine as well. And we have to be our best advocates.
Absolutely. And I still want to get to so why should other people care? We see this attack on DEI, diversity, equity, and inclusion, and even a bill that was passed that prohibits medical schools from considering race as a factor for admittance. And we're seeing, the dismantling of programs to help get Black students on the track to med school and to help them be successful in med school. One could say, and also when we look at the percentage of doctors that are Black in this country being less than 5%, I think, or so we got to somehow get other people, right, to understand why racism in we've talked about how it manifests, but why that's a problem. Why that's a problem for the overall healthcare system. Why is that a problem for the overall healthcare system? Or is it a problem for the overall healthcare system? If I'm white, why should I give a darn? Why should I care about these outcomes? Why should I care about how racism is showing up and implicit bias is manifesting itself?
Well, because if you don't get great surgeons like Dr. Ben Carson, if you don't get great surgeons like Dr. Leslie Walton, if you don't get great surgeons like Dr. LaSalle Lafall, Dr. Matthew Walker, there are many, many, many brilliant African-American doctors I can name currently and have come through the years who are available to provide health care for all. And I'm telling you, we can just talk.
Dr. Alan Mask and Deidre Mask. Mm-hmm.
That, but the problem too with this anti-DEI is that the racial disparities and so forth that we're discussing here tonight are not going to be improved if you're shunning away and limiting the number of minorities that are involved in medicine as well. And remember, there was this push by, I think there was a urologist in North Carolina who was anti-DEI and was saying to the North Carolina medical schools, hey, what are you guys and gals doing admitting people who aren't qualified? DEI never was about admitting people who were less qualified. It was about giving everybody a place at the table. And the
That's
people
right.
anti-DEI forget that we all have to pass the same examinations. When I finished the UNC School of Medicine, there's pass and there's fail. If you don't meet a certain grade, then you don't go to the next level. You don't get an internship, you don't get a residency, and there are all sorts of laws about licensing and so forth that we all have to pass. And so the sense that you've got minority doctors out there who in some sort of way less qualified than others. And in a lot of ways, I would say we always have to work 10 times as hard as anybody even get wherever it is we are. In my medical school class, all of us graduated on time. All of us went on to have good careers as interns, OBGYNs, pediatricians, and so forth. There was only one person that I can think of that didn't graduate in my class, and he dropped out for non-medical reasons. And so we want our healthcare force in this country to be as good as it can possibly be, and to eliminate any particular group, whether we're talking about American Indians, whether we're talking about African Americans, whether we're talking about East Asians and so forth. We want really good, competent people to be there. I know when I was working some years ago in the Cape Fear Valley Hospital emergency room, Dr. Mort Meltzer, the guy who hired me there, he says, you know what, we want to have a rainbow coalition of doctors here seeing our patients, because when patients come into the hospital, we want them to see representatives who look like them. We want this
That's right.
rainbow coalition whereby we're all working together. And I want the person sitting next to me on the bus to be flu free. So I want them to get their flu vaccinations. I want them to get their COVID vaccinations, measles, mumps, and rubella, and so forth. And so we want the whole community to experience good health care, because that's what keeps us all in good health.
That's right. And studies have shown that patient outcomes are better when the doctors reflect the culture of the patient. And so I often say, could that be the explanation? Part of the explanation is this lack of concordance or lack of, um, uh, cultural sharing the same culture with physicians and with medical teams within our healthcare system. If it's all white and we're seeing all these outcomes that are negative, perhaps that's another reason why you need to have a rainbow coalition of physicians on your team and and nurses and.
Absolutely. A lot of patients will simply do better if they're seeing physicians who look just like them. And I'm not saying that, okay, you got to go to a Black physician,
Right,
a white physician, but outcomes have been shown African Americans to be better when they're treated by doctors who look like them, in terms of compliance with explanations about nutrition, when it comes to taking medications, and in terms to being able to communicate not only with the patient but to communicate with their loved ones as well. And then just to be a general advocate, I think, for the person. We're looking at the situation in the emergency room. It's been documented time and time again that when we are admitted to the hospital, we tend to be delayed in terms of getting up to that room that we want to go to. And if we're advocating not only for others, but advocating for ourselves as well, then you're less likely to see that. We know, as you pointed out, that only about 5% of the physicians in this country are African Americans. I think about half that number are actually African American women. And we're seeing the numbers go down. I know at the UNC School of Medicine, we have a lot less students who are of color who admitted in this last class that came through. And in general, this whole sentiment, this whole chaos that we're going through right now is really making it more difficult for us to become doctors and to become PAs and nurses and so forth. And so we need to, in the interest of our own good health, to make sure that we're advocates to make sure that we have representation across the board.
right. Speaking of chaos, so there were some decisions that were made out of Washington, out of this current administration. One was to defund USAID and also other health related and particularly public health related programs. What implications will that have, do you think?
Having negative implications all over the place. If you just look intrinsically, you look at, for example, the farmers here who provide food to this group to ship overseas to people who are having famines and so forth. The research and so forth that comes out of and the leadership that comes out of our CDC here, when they're cutting the CDC staff, then that's affecting that as well. So you're talking about food that's rotting, or you're talking about people who desperately need medications who are not getting those medications. You're looking at children who are hungry, who are not being fed. And for the life of me, I don't know where that consciousness is. It seems to be an easy decision to me that that's a group that I wouldn't touch at all, because we're a very rich, a very blessed nation. And in a lot of ways, what we're doing by shutting that down is that even internally, as I mentioned, we got farmers who have goods that aren't being bought. We've got jobs, people who need these jobs and so forth, who are being let go. And then across the board, you won't be able to measure it acutely, I think, within a day or a week or three. But once we start collecting the stats as we get further down the road, we're going to realize how cruel that really is and what an effective organization we really have before us. And the sense that we would shut that down simply makes no sense to me whatsoever. And we all need to, in the ways that we can, to be advocates for that to be reinstated and that we take care of not only ourselves, but we take care of our neighbors as well.
Yeah, and also, so what's going to come next? Telling us we can't travel abroad because, like you said, we are a rich nation, and many of us have been extremely blessed and get to travel outside of the borders of the United States, for vacations or seminars or whatever. We get to travel outside of the United States. And the thing I thought about was, okay, so if you are stopping some of these programs that were helping to control the spread of infectious disease abroad, what happens when I go to this particular country and there's widespread outbreaks of some type of flu, some type of infectious disease, right? So malaria or whatever, or some new COVID type infection or disease. And then so you were basically putting us at risk, Americans at risk. So I thought about it. So what's next? I thought. So is this the first step into saying don't travel outside of the United States? And then the other thing that just doesn't make sense is we have companies. We have multinational global businesses that are all over this world. So where Americans are working. My girlfriend Kim, shout out to Kim, KB. I won't call her out. She's kind of shy. She stays out of the social media. But KB from Chapel Hill, she used to work for Carter's, and she did quality control of their Asian um, um, uh, companies, not Asian companies, the places that made the clothes, factories. That's the word, factories, Asian factories. So she was traveling abroad all the time. I think about the person who took her place, who's working for um, multinational, global corporations. So it just didn't make sense at all
Yeah.
from a lot of perspectives, right?
Because we in America are not isolated. We travel, we have people coming to our country, we go elsewhere. And even within, there's an outbreak now of measles down in Texas.
Yeah.
And not isolated from that. I practiced medicine for over 30 years. I've never seen a case of measles. You know why? Because our vaccination programs have been so successful. And so, part of the message we want to get out today is that vaccinations are the wave of the future. That's why we don't see cases of polio or we don't see cases of measles. And so we want to continue to say to people to get the vaccination that you need. And as you point out, we're not isolated. We're gonna travel. We're gonna go to Europe. We're gonna go to Africa, and we're gonna have exposures on in airplanes and trains and so forth. And so, this notion that we don't worry about this group being sick because it won't affect us, that's just not true at all. And the same thing, Michelle, has to do with the CDC. One of the things that I pointed out to the French students I lectured to not too long ago is that while our delivery of healthcare may not be as sophisticated as in some other countries, we've got the CDC, we've got the NIH, which is so strong. We have the New England Journal of Medicine and our medical journals and so forth, where we as Americans have been carrying some weight when it comes to that. And now they're disassembling, the CDC and the NIH. And when I talk to my medical colleagues, we're saying, I says, what are we doing? This makes no sense at all that across the board, we're firing people and things that need to be done, people who are working behind the scenes. If you're firing them, then we're not going to be effective at what we're doing. And at some point down the road, we're going to pay a big price for that.
Absolutely. And going back to the topic for today, what makes America, I mean, what's making Black Americans sick? You know that saying, when white America gets a cold, Black Americans get the flu. So the brunt of that disproportionately will be shouldered or carried by Black Americans across the socioeconomic strata, which brings me to maternal mortality. Uh, Regardless of a woman's wealth or income level, we still, as Black women, have high maternal mortality rates. And we have our babies have high infant mortality rates. What's stress? Yes, because that's the area that I've studied and know well. Um, what else in addition to stress? Does it go back to that R word, racism, or what's explaining these very disturbing rates of infant Black maternal mortality and infant mortality?
Well, it has to do with access to medical care, making sure that when a woman's pregnant or early on, that she's been examined with blood work, getting vaccinations and so forth, making sure that mom to be is getting the appropriate nutrition and so forth, so the baby develops in the uterus to become a healthy baby some 9 to 10 months later. It has to do with having a healthcare system where people can get good advice, or when they can have their questions answered, when patients can be reminded not to smoke cigarettes while they're pregnant, not to drink alcohol while they're pregnant, to make sure that conditions like preeclampsia are being treated, to make sure that you've got hypertension that's being treated, to make sure that you're getting your vitamins and your folic acid, and that any underlying medical conditions and so forth that you had are being treated appropriately. I mean, it's a whole constellation of things that have to happen from the time of conception and even before conception that will keep our wives and our mothers healthy, so that when they do deliver, that they deliver a healthy baby. And so it's something that we need to keep focusing on. In other countries, I think, for example, I was reading that Norway, I think in a given year, I think I read someplace where they had not one single maternal mortality, one single death. And so it's possible that if you provide people with universal health care, and we're talking about the basics, we're not talking about any rocket science. I mean, if you provide women with basic health care, and then once the baby is born, that you're able to get good nutrition, you're able to get breast milk, you're able to get formula, you're able to get vitamins, you're able to get immunizations and so forth, that there's, good child care, for example, if mom needs to go back to work, to make sure that when you're traveling, that mothers have car seats and so forth, so that infants are being transported appropriately, making sure that you've got good housing for them. With this cold night we're experiencing right now, that you have a warm home for kids to be housed in and so forth. So there's a whole constellation of things that we need to be thinking about. And we're in a lot of chaos right now, but what we've got to do is, Arthur Ashe had a saying once. He's a famous tennis playing civil rights leader. I'm sure everybody knows the name Arthur Ashe. Is that, start where you are, use what you have, and do what you can. I think that's where we are.
Yes.
We really, those of us in the medical profession, as well as those of us who are not, have to come together to try to provide some solutions, particularly in this chaotic time.
That's right. And when you talked about smoking and drinking, I'm like, honey, Black women, we need it's hard given all the stressors that we're challenged by. But yes, ladies, if you can, stop smoking and stop drinking. Because even from my understanding now, they used to say, oh, a glass of wine was okay. But I've read in different journal articles that alcohol, period, is a carcinogen and it causes cancer. So try and limit it, as good as it might be and make you feel. Try and limit your intake for sure of those two carcinogens. Then, and that will definitely go a long way. Yeah, I want to ask you, what keeps you up at night, if anything? I mean, I'm saying this in a rhetorical way, like not that you are sitting up at night worrying, but what are some issues impacting the Black community that keeps you up at night?
Well, first of all, this assault that's on us right now, these microaggressions that all of us go through. And, you know, as James Baldwin said some years ago, it's amazing we all, as African Americans, are not in constant rage with the racism that we all have to deal with. And I don't need to articulate that because everybody's got, 100 stories about these micro aggressions and macro aggressions and so forth that we face all the time. But the thing that keeps me up at night is this lack of an internal barometer, a thermometer, the litmus test that lets people know right from wrong. And it just seems to me that 47 and a lot of the people in leadership in the country right now just don't really have any empathy for other people. And you should have empathy for people, not only because it's the right thing to do, but of course, that helps with your own healing. And it also has to do with helping and supporting your fellow man as well. And I'm just perplexed as to the direction that we're going into, how people, when they have a moral compass, that they can't understand that people need basic health care, people need food, that people need safe housing. And there's so much that we can do in that sphere and not really make any individual sacrifice, nothing that's going to change our life radically. One of the ideas that I liked with Vice President Harris was that this idea that we extend Medicare to take care of people when they're in the hospital with a stroke or some chronic condition beyond that 100 days. If you go in the hospital and you're older and you got some major is that Medicare will pay for you for 100 days to go someplace. Okay, you're discharged from the hospital. But so many people now are finding themselves at the age of 89 or 92, they've exhausted that 100 days and they don't have a place to go. And so Vice President Harris was saying, gosh, we got to figure a way within Medicare to be able to expand with these assisted nursing facilities and so forth, so our family members and our friends have a place to go. Those are the kind of problems that we need to be solving. I'm not even sure how DEI is even on our radar right now when we're talking about feeding Americans, we're talking about healthcare, we're talking about, keeping the country safe. All the things that 47 is talking about, I don't even know how that all becomes a priority whatsoever. And so, start where you are, use what you have, do what you can. We've got to figure out a way to come together to bridge this, to make this situation as best we possibly can. And we'll get through this. And we're going to we all have to have a cooperative spirit. So they're doing this
Absolutely.
time we can come together and get through this thing.
I said we might end up having to go back to the old country docks where I pay you with a chicken and a bag of potatoes out of my garden or something. Seriously, we also have to, I think, gosh, we haven't even talked about the cost of healthcare. Why is healthcare so expensive in our country compared to other countries? And yeah, so we haven't even talked about that. So somewhere along the line, people have got to also um, decide, who are in the healthcare business, what's enough to be okay and comfortable. If you are a CEO of a a payer of an insurance company, or do you really need all the stuff that comes with that, all the special trinkets that come with it, including $multi-million salaries, when you are serving a population that is going into debt and losing their homes and declaring bankruptcy just to pay for a surgery, a life-saving surgery. So we have to have a conversation too, I believe, about getting a handle on this outrageous cost to take care of our health. Someone said that we don't have a health care system, we have a sick care system that is very profitable for the people, for the players in it, and not the patients. And so I think we got to have that conversation too, because really where we might be forced to go under 47 is seriously back to the country doctor model, to the neighborhood doctors who will say, and physician and pharmacists who will say, well, I'm going to help find the cheapest drug for you, or I'm going to help. I went to see my doctor today, and she shocked me because she said, well, we got these, which were pharmacological responses. And she said, or you can try this. And it was like an herbal response, a naturopathic. Sorry. And I was like, well, thank you. Thank you for telling me that, because I got some of that in my cabinet that I took one or two of, and I didn't even really think it was going to work. But if you're saying there's science behind it, I'm going to try that first before I try this. But anyway, so I'm glad, you mentioned that, because we do need to probably talk about that at some other time. The other thing I want to just kind of ask you to give us a list. What are the top 5, 10, five, we can go with 5 if 10 is too many. You've already mentioned them in the conversation, but so that we are clear, I don't want anybody to leave here, especially African Americans. What are the main things we can do to help decrease the risk and increase the probability that we will, or odds that we will live a healthy life? Because I'm like my girlfriend, Demetria. She said, the last thing I want to do is be old, poor, and Black in America. So, and sick. So, sick, old, poor, and Black, sick, old, and poor. That was it. Black, sick, old, and poor. So, what do we need to do?
Well, let me say, first of all, that the number one predictor of how long we will live is what our kidney function is. And so I want everybody, when they're thinking about going to getting their blood sugar checked and cholesterol and blood pressure, to think about, you also want to know about your kidney function. What are your kidney function tests showing, and what is your urine showing? Because if you want a predictive how well you're going to do, that's the one thing that you can look at. You want to make sure to focus on that. Talk with your doctor about, hey, doc, what is my kidney function like? Now, to answer
And
your
what are the measures for that? What are the things?
serum creatinine, and there's something called
And what should that be?
well, that should ideally be less than 1.4. So it should be someplace between 0.8 and 1.4. There's also something that we calculate called the GFR, the glomerular filtration rate, which measures how well your kidneys are removing waste products from the blood. So we want that number to be greater than 60. If you can be 70 or higher, that's excellent. But once it starts to go below 60, then we know the kidneys are not functioning as well as they need to be. And of course, as the kidney function drops down, the biggest bad combination, if you will, is to have uncontrolled high blood pressure and have uncontrolled diabetes. Those are the two things that mostly take away from our kidney function. And we also know that for some reason, African Americans progress to end-stage kidney disease much faster, even if the numbers are the same as our white counterparts as well. So you want to make sure you take good care of your kidneys. So one of the big things, Michelle, this is so important to mention, is that they make sure that patients are staying away from pain medications. Medications like ibuprofen, naproxen, the non-steroidal anti-inflammatory.
Oh,
People pop those things. They got a headache, they got backache, they got knee pain. Those are things that you really, really, really have to be very, very careful with, to stay away from those medications that can be harmful to your kidneys. We know that if you can bring your A1C down, which is a test that we use to measure diabetes and so forth, that can come down 1%. We know that's going to significantly improve your kidney function. So if you can keep your blood sugar under good control, ideally keep your blood pressure less than about 120/80. That's what you want to aim for. But let me quickly mention, I had a conversation with Dr. David Satcher a few years ago. He came to speak at Duke, and I got a chance to spend about an hour with him. And he said the number one intervention that we can all take to improve our health is lifestyle change. And he talked about that's the number one intervention that we can have is lifestyle change. And he talked about 5 quick things that I'll mention. One is eating
okay.
5 things of fresh fruits and vegetables every day. Number 2 is to get 30 minutes of exercise, 30 minutes of exercise times a day. to avoid toxins like alcohol and tobacco, to avoid toxins, to practice safe sex, and the final one is to practice some stress reducing technique every day. That could be transcendental meditation. It could be yoga. It could be Tai Chi. It could be prayer. It could be exercise. But every day, like you think about, taking your vitamin, you think about having, a glass of juice in the morning, whatever, you want to make sure that you practice some stress reducing technique as well. And those are easy things to do, but things that a lot of us just won't do. All right. 30 minutes of exercise. It ought to be some aerobic exercise and some weightlifting. But I tell my patients, if you can get out, set a stopwatch and just walk for 30 minutes a day, that'll be fine. Now, you can't pretend like you're
Does speed matter? Does speed matter?
It does matter. In other words, the way I tell people, you go out with a partner, you shouldn't be walking so that you can have a continuous conversation. If you're not out of breath enough, that you can't talk, then if you're talking, you're not going fast enough. So I tell people in general, and the exercise physiologists know this a lot better than I do, but I tell my patients you should be able to walk about a 15-minute mile. So in 30 minutes, you should be able to walk 2 miles. That's basically what I say. But even if you can't do that, if you'll get some comfortable shoes, make sure you're walking in a safe area and do 30 minutes at a time. And you just got to do it. There's no excuse. And when it comes to eating, we all grew up with fresh fruits and vegetables. We're talking about apples, oranges, pears, all the basic stuff. And vegetables, we're talking about kale, we're talking about collard greens, we're talking about spinach. I do a lot of stir fry, I like bok choy is a good choice. Peas, kiwi fruit, berries, particularly blueberries, strawberries, beans, those things are all good for you. Cut back on your red meat intake. Try to limit your red meat intake. And red meat, of course, includes, steaks and burgers. It includes pork as well. You want to cut back on that. And one thing is to cut back on the sheer volume of how much we eat as well. We know that about 38% of African Americans are obese, more than Hispanics and more than Caucasians as well. We eat a lot of food and we eat a lot of the wrong stuff as well. So you can have poor nutrition and still, be eating the wrong things and have the weight problem as well. So we all have a problem with that. I'm working on my weight as well, but it's just a constant thing that we all need to be working on.
And what about no limit sugar? I say if it's white, it's probably not right in terms of our food. So no sugar, no white stuff,
Yeah, the sugar,
starches.
that's so important, Dr. Laws. I'm glad you brought that up. Sugar. We talk a lot about fat, but I'm telling you, sugar is what's getting us in trouble. The sodas, the unlimited sweet tea. A lot of us put a lot of sugar and cream in our coffee. Going to these coffee places and getting that rich, hot chocolate with whipped cream. We're talking about ice cream. Who doesn't love ice cream? But ice cream is
Right.
full of sugar, it's full of fat, and just always keep thinking to yourself. And one thing that I want to emphasize that I'm working towards now is just drinking more water. We just have to drink more water. So when you go to a restaurant, if you want to save a lot of money, you go out with a party of 4 or 5 people. A soda now is like 350 at a restaurant. Just get water. You can save yourself a lot of money, and you'll be a lot.
Mm-hmm.
Most of us are chronically dehydrated. So drink more, water in the morning, noon, afternoon. Be sure to tank up before you exercise. Keep some water by your bedside. Water is good for you. And it's
Now, some people are suggesting to put a sprinkle of salt in your water. Have you heard that? Supposedly it hydrates you better.
not really an advocate of that because the salt content
Okay.
in the water may kick your blood pressure up as well. I would
Okay.
put a little lemon in their water, put a little lime in their water. What I find works for me too is sometimes sparkling water is better. And what I find also that works out well is to have cold water. Like when I leave a bottle of water in my car and I go out the next morning, I love drinking cold water. Some people like it room.
Mhm.
I think having the water cold is good as well. So
What about sleep?
Oh, sleep is so important as well. We recommend that people get about 8 hours of sleep per night. And it should be restful sleep as well. You don't need to have the television on in the background. You don't need to be under the covers, operating your phone. You need to make sure that the room is cool and that it's comfortable and that you create a scenario whereby you feel at rest and you feel safe and you're able to get a good night's sleep. So that's a good problem. That's a good point. The other thing I would mention is that if you snore, sometimes that's an indication of sleep apnea, whereby the airway is being blocked at night whenever you turn to sleep and so forth. And so if that's the case, then if you find yourself the next day being irritable and not feeling well rested and so forth, sometimes you can be blocking your airway off when you sleep like that. So you really need to see a sleep specialist. You can talk to your private doctor about that, but the neurologists who specialize in sleep, who can then do a sleep study and determine whether you need to have a CPAP machine and that sort of thing. So snoring can be deadly. If you snore, be sure to investigate that.
Well, I tell my husband I don't get restful sleep because he snores, and we gonna be one of them couples that sleep in different bedrooms after a while. But the amazing thing is he wakes up rested, and I'm like, I guess you are. You slept like a crazy person. But yeah, I don't snore, but he does. Apparently, I snore if I'm really tired. He tells me, but he snores all the time, and that interrupts my sleep. This has been wonderful. This has been a meaningful conversation that we needed to have. I tell people the only way you're gonna make it through these times that we're living in now. And look, I'm not talking about it from a political perspective. I'm talking about it from a spiritual perspective. I'm also an ordained minister, and some of this stuff is just troubling to my soul and spirits. And so if we're gonna make it, we got to be healthy. We got to be healthy. We got to be healthy to strategize on how we keep our communities safe and our families safe. We want our children to see us age gracefully so that they know what that looks like and they themselves have the tools to do that, so that there's this passing on generations, a good strong legacy, like when we look back, like people like we inherited, um, people who had very little, our ancestors who had very little. And I know your mom can tell stories of growing up in rural, North Carolina, who had very little, but who produced doctors, who produced, lawyers, who produced business owners, who produced teachers, who produced just solid, good, strong people, no matter what profession or what jobs they had. And so health is really important, and our health has got to be a priority. And you've given us a whole list of things that we can hopefully take and do. They are not very hard. They shouldn't be hard for us to do. Avoiding toxins might be challenging for people who have addictions. So reach out for help if you are addicted to alcohol or nicotine or cigarettes, tobacco. Eating 5 servings of fruit and vegetables, 30 minutes of exercise a day, cutting back on the types of bad food we eat, the processed meats, the red meats, and the volume, the amount that we eat. Intermittent fasting, real quick. Is that a good thing for people to be doing? A lot of people are on this intermittent fasting.
I think it's a great idea because it will also limit it'll help your metabolism and also limit the amount of food that you eat. So, for example, if you can not eat, let's say if you have dinner about 7 o'clock and 6 o'clock at night, and then go at least 12 to 14 hours. That's a good long fast. Okay, so you can not eat at night. So if you have dinner, let's say at 6 or 7, get rid of the snacking at 8 o'clock, 9 o'clock, 10 o'clock, and so forth. And then the next day, we encourage breakfast. So maybe have breakfast a little later. But if you can go, long periods of time without eating, we think that is important. I like the idea of intermittent fasting. I do it as much as I can. Yeah.
Awesome. Well, the good doctor does it. We're going to do it, right, people? All right. I want to leave us on a healthy, happy, positive note. Three books that you love and you would recommend.
Okay. One, I brought a copy. It's called The Address Book. This is a book that was actually written by my daughter, Deirdre Mask, and it talks about how the address that we have helps to determine how healthy we are. In the book, she talks about in West Virginia how sometimes people don't have addresses and they identify themselves as being up the hill, next to the Red Barn, or
Mm.
about being in India where people, a lot of people don't have addresses. She talks about in Tokyo how, you don't have street addresses per se, but they have numbers at the blocks and so forth. They talk about if you happen to live on Martin Luther King Boulevard, it's a good likelihood that you're living in a Black community. So the address book,
Except Chapel Hill. We were intentional about that, except Chapel Hill.
exactly. But the address book is a book that I like a lot. This is one
Okay.
of books by a guy named Thomas Hauser. He wrote a biography of Muhammad Ali. Muhammad Ali is one of my greatest heroes. I had the distinct honor to attend his funeral when he passed in 2000.
Wow.
That's a great biography. And the last book I'll mention, I'm gonna let you go, is a book called $1 Million Toolbox. $1 Million Toolbox by a guy named Ty Boyd. It's a book on public speaking. You don't need that because you're such a great public speaker, Dr. Law.
Oh,
Telling you, it's a book that for a long, long time I kept with me all the time. I kept it in the bathroom because it talks about principles of good speaking. And it's a book that if you're looking to give your high school graduate or your college graduate a book that would help them with public speaking, then it's Ty Boyd, Boyd. The book is called $1 Million Toolbox. It's only about maybe 100 pages, and it really transformed my life. It helped me to be a better communicator. It's available in paperback. You probably can get it for $10 or so, but it's one of my favorite books.
awesome. And before we end tonight, I also like to ask my guests a message. If you were talking to your younger self, what would you say?
Well, let's aim to repair a small piece of this broken world. And what we have to do, Dr. Laws, and you've been such a tremendous community leader in so many facets and so forth, but let's all try to do something to make this world. My mother's one of my greatest heroes. Just to give you one quick example, there was someone not too long ago whose house burned down. And she called me. She says, "Who's the Asian reporter at the TV station?" And I, what are you talking about? And so I gave her the name of the person that she was talking about. So she calls her and she has the name of a lady whose house had burned down because she wanted the lady's address. I said, "What are you talking about, Mom?" She says, "I'm sending her $50. And if
Mm,
cent of your audience would all send this lady $50 and she could rebuild her house."
wow.
Yeah, that's exactly right. And so my mom is a doer. So I think doing this,
Yes.
we've got to support one another to try to repair a part of this broken world. It's a matter of taking some food to the person next door. It's a matter of cutting somebody's grass. It's a matter of loaning somebody some money. It's about paying for a kid's lunch. It's about being a volunteer someplace. It's about doing whatever we can do to make the world a better place. And then make sure in all this chaos we're not turned against one another. This is a time when we really have to come together, particularly as a people. And one thing about us that we're very soulful people. You know what?
Yes.
We're soulful. You get to.
Yes.
I mean, we're very soulful, very caring, very empathetic people. And so this is a time for
Mhm.
it really is.
Yeah, I said it's time to start having. I don't know if y'all did this, but growing up in Chapel Hill Public Housing, we used to have parties at home all the time in the neighborhood and played spades. And my husband doesn't know how to play spades because he didn't grow up like that. He grew up with a mama who was a teacher and a daddy who was a businessman and all that stuff. But on the other hand, his wife. So I said, you know what? I'm gonna have me a party in my yard, some cards, and just a good old cookout. That's the kind of stuff we need to do. We are soulful. We need to find joy and find opportunities to come together and to bring people together. Yeah, so that's an inspiration. I want to say about your mom. I love her. So as you mentioned, I've spoken all over, actually all over I've spoken in Africa. I've spoken all over, and presented all over, and there are a few people whose applause and whose praise just have meant the world to me. And your mom is one. And I never forget when I guess she had heard me speak for the first time. And she said, "You got it. She just loved to hear me say." And after then, she's like, and I felt that. I just felt that in my spirit, and that was such an inspiration. So it was her, Miss Mary Perry, and Andrea Harris, and of course my mom, my grandmother, and all of them. But those ladies truly inspired me to do and to know that I was walking in my gifts. And so your mom is an amazing woman. She definitely is. Well, unfortunately, this is all the time we have. And we've gone over just a little bit, but that's okay. I just want to thank you, Dr. Mass, for taking the time. I'm going to have you come back. I'm also going to have your lovely wife come back to talk to us ladies about this weight, that the menopause weight, which is a thing. And that's what I went to talk to my doctor about today. I was like, I'm doing everything you're telling me to do. And before I let you go, I know people are like, I thought you were ending. But I went to talk to her because I was like, okay, first I was saying, I'm not going to take these weight loss drugs. Then I went to her, I was like, look, I think I might want to try them. And she was like, well, try this first. So anyway, so that was the thing. I won't have you weigh in on that because I'm sure a lot of people might get their feelings hurt. But
Well, the medicines like Ozempic and so forth, people are having a lot of success with it. It's still an early medication. We have to put on our medical crystal ball to see, what may happen further down the road. But I'm telling you, people would really work with the fundamentals, get a stopwatch and do that 30 minutes a day and really cut back on the sheer volume of what we're eating, to cut back on the sugar, as you pointed out. That's so very important. And you're going to see the weight dissipate just based on that, I guarantee you. Yeah.
oh, great. Well, that's encouraging because I'm still not sold on. I have no chronic health condition, no hypertension, no high cholesterol, no diabetes, none of that. Thank God. And I think the older you get, the higher your risk are for some of these things. But once you reach a certain age and you haven't had those conditions, then you're doing well. So I want to keep doing well. My great grandmother lived to be 102. We found one document that said 103. Her sister Lula 105. So, and then her brothers and sisters, the youngest one to die was her baby brother, Uncle James, and that shocked all of us because he didn't make it to be in Centurion. But what is that one? The 100 when you live to be 100. Yeah, the 100-year-old people. But
Yeah. Yeah.
yeah, so but anyway, so I'm trying, and one thing my mom keeps saying is, well, don't start taking any drugs and then leaving them putting that in your system. So that's the only reason why I've been so hesitant about getting on weight loss drugs, but I'm getting a little frustrated. But anyway, that's a topic for another segment. Thank you everyone who was able to log in. We will replay this. It will be on YouTube, so please share it. And I'm not really good at promoting stuff, but I'm starting to promote my YouTube channel. We need to reach 100 mark at least, of subscribers and more. And I think putting out quality content obviously is one way to do it. But let's continue the conversation. Thank you, Dr. Mask. You all can replay tonight if you haven't had a chance. Just go to my YouTube channel at Michelle Laws 007 on YouTube. And we will see you the next time on another segment of Meaningful Conversation. Make sure you take all the advice that Dr. Mask gave us about how we can live healthy lives. We all are going to need as many of these tools as we possibly can in our toolbox to make it. And stay encouraged and stay inspired. There is still a God who frowns on evil and who requires that we do justice and love mercy and walk humbly. So let's stay focused on the main thing. Peace and blessings, everybody.